Welcome to the Dental Breakdown Show. This show is where we break down issues in the dental marketplace. My name is Christian White, CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. Let's introduce our guest today, Dr. Jeff Fordice. Why don't you tell us a little bit about yourself?
Well, it's one of those things where most people don't like to talk about themselves, but I understand that when a patient is going to a website or a YouTube video or something and is trying to decide, okay, who is going to do my dentistry, having some knowledge of who's going to do your dentistry is important. So I guess I'll jump in and talk a little bit about myself. I was actually raised in the Twin Cities, and the reason I'm in Fairmont right now is that during dental school, I met my wife, Paula, and she was from this area. So I ended up down here, went to Hamlin, University of Minnesota, did a residency at the University of Iowa, and then practiced in Duluth for a couple of years, and then ended up in Fairmont when a practice opportunity came along. And it's been a great life here, and raised 4 kids. They're all adults now, are married. I've got 8 grandkids.
Congratulations.
Yeah, well, that's a good thing. Unfortunately, back in 2017, Paula got brain cancer and passed. She told me she wanted me to get married again. First thing she said to me after she got the diagnosis. And so fortunately, I was able to find an awesome woman named Ann Grunwald who had lost her husband.
She is awesome, by the way.
Yeah, lost her husband in a farm accident, and we've been married about a year now, and life is good. I have been truly blessed.
Wonderful.
So, and the biggest thing, as far as for a patient, is that I absolutely love doing dentistry. It just fits me. So I like it.
Tell me more about that. Well, you say it fits me. What does that mean to you?
Well, you what do you want to be when you grow up, kind of thing. I never decided I wanted to be a dentist when I was a kid. But as I got older and looked at my interests, my skill sets, I'm really an artist at heart. I love doing artwork. I love doing hands-on craft stuff like woodworking and restoring cars and painting and all these different things. And I also like people. And so to have a profession that combines technology and artistry and working with people just fits my skill set. And that's why I like it.
So continuing with that, was there something, as you were kind of tripping to the tulips of life that said, that it was the tipping point that made you want to become a dentist? Was there a situation or something in your life that happened?
Well, I did go to, when I was in high school, I was able to go to a Rotary Club function where you looked into professions. And I was hosted by a family that had some connections to dentistry. That got me interested a little bit, but it really was investigating what different professions needs were and what skill sets you had. It was in college that I finally figured out that that's what I wanted to do. So, yeah.
Great. Let me ask you a little bit about Birch Street Dentistry. What is it about your dental practice that sets you apart from all the other dental practices in the community?
Of course, most dentists are doing a good job and everything like that. I think what sets us apart is that it's like trying to pick some artist's painting per se. Okay, when you walk into an art gallery, there's just going to be a painting that might speak to you. Well, to me, doing dentistry is much like creating a painting. It is artistry, but there's also the technology side of it, and we have been keeping up on technology. We have lasers and 3D cone beam X-ray machines and machines that can make crowns right in the office, and different camera systems and digital X-rays and all these different systems that come together that enable you to it's your artist tools per se. It's enables you to have an objective to help somebody get a healthy smile. So you can have an objective, but you have to have the ability to then pull off or do that dentistry to a level that is literally like a piece of art when you're done. And I think that's what sets us apart. The other really big thing is my staff. I have long-term staff, and they know how to do things and make this place run and how to treat you as a patient very well.
Mm-hmm.
So that's the two big things is we work together as a team. So to get all this stuff done.
That's wonderful. That's great. So tell me this. I don't know if all your patients know this, but you've added a new service, which is dental implants. And that's a new piece for Birch Street Dentistry. Why don't you tell us a little bit about that?
Well, I've had a passion to learn implants for quite some time, but I do so many other things. I do orthodontics and lasers and all these other things. And finally, I just decided that, you know, one of the newest trends in dentistry over the last 20, 30 years is the rise of implants for replacing missing teeth. And I finally decided, you know, I'm just at the point in my career where I really want to do this service for patients. So I went and got the training. I bought a 3D cone beam x-ray machine and have started placing implants. And I think it's a very, very great alternative to bridge work or removable things. To have something that's fixed in place and works well is just a great service for patients.
Mm-hmm. So it's another way for you to effectively, you know, help a patient basically change their life.
Yeah, so you can take somebody that has no teeth or a few missing teeth and put those teeth back in place, and they really function almost at 90% of what natural teeth do. So they're a really effective way of restoring a mouth. Yeah,
okay.
Really like
So let me ask you, just kind of take a little bit of a right turn for a second. So in dentistry, we have these things called teeth, and then we focus on the teeth. But I think in dentistry, and I think you would agree with me on this, you know, there's a difference between being tooth-centered and being a little bit more of a patient experience-centered dental practice. Tell us about that.
Yeah, I think many people, including patients, think that it is all about the teeth, and it is in a sense. That's what I'm here to do, is to help people maintain their teeth. But you are right, it really is the patient experience. If we can give you the confidence that you can get your dental work done and then deliver on that comfortably, and to do it with a staff that's going to treat you nicely, and I'm going to try to treat you the way I would treat a family member. And if we can get you to the point where you don't actually mind coming to the dentist, that you know that you can get through this experience, I think it'll be a good experience for you, and it'll be good enough that you want to send your friends. Mm-hmm. So yeah, so that's what we're focused on, is trying to, from the time you walk in the door to the time you get out the door, that it's a positive experience for you.
Okay, great. In the dental marketplace right now, let's talk about some trends that you're seeing just as a dentist, just so we can kind of share that with obviously with patients who may not know as much about what's going on as you do.
I think there's a lot of different new trends in dentistry. Obviously, the one we already mentioned, which was implants, that's coming on real strong. Mm-hmm. In the world of orthodontics, we're now doing Invisalign. I've been doing braces for over 25 years, and now I think 80% of the cases I do are Invisalign. So that's changing the face of dentistry. Another really big difference is microdentistry. Now, what that means is that I'm using little lasers that can detect decay, and camera systems, as well as the x-rays, to find decay when it's really tiny. Then I can use a water laser to clean that small, we caught it early, decay, and then repair that without having to do much to the tooth, which retains its strength, which means I do less to your tooth, you have less chance of having crowns and things like that. So those are I would say, some of the bigger things. And of course, I mentioned lasers. Lasers have changed. I use my laser 10, 12 times a day.
Mm-hmm.
And that's really changed how I approach repairing teeth.
Now, given the state that we're in right now, the fact that we're in the middle of a pandemic, and with the COVID-19 virus, how is that going to, maybe tweak or affect Birch Street Dentistry as we move forward?
Well, I think that's going to be a dynamic thing. We've already using universal precautions, so I'm really not too concerned about it. From a patient safety standpoint, I think, with the sterilization methods that we have and all the different ways we do surface decontamination and so forth, I think it'll be a manageable thing for us. We might have to change some screening protocols. Hopefully the testing things will be coming along fairly soon, and then testing will change the game for us, I think.
So you guys seem to be well ahead of things. Would that be a good thing to say? A good way of saying
Yeah, I think, if you can prepare for hepatitis B and TB and all these kinds of things, I think we're going to be well prepared for this kind of a virus.
Okay, great. Dr. Fordice, being the fact that you have been a dentist for a number of years, and you're 25 going on 26.
Yeah.
For younger dentists who are either entering the profession right now or have been in the profession for less than a couple of years, what would be your top 3 tips that you could give them to be successful, to be a really good dentist, based on your experiences?
I think treating your patient the way that you would want to treat a family member would be number 1. I think that's the key to success. If you just keep that in the forefront, I think you'll be successful.
Mm-hmm.
Secondly, have systems to make sure that there's a way that everybody, the patient, the staff, and myself all understand how we're going to proceed. I think that's really important. And then I think pursue the things that you love. If there's a certain area of dentistry that you really enjoy, and pursue it till you're excellent at it. So I would say that's the top 3.
Okay. In terms of, your ability to be a leader in the dental practice, tell us about that and how important that is, being the fact that you're a dentist, you become an owner, and everybody kind of looks up to you in the practice.
I think being an effective leader is really getting past yourself. I don't know how to exactly describe this, but I have certain skill sets and I know what those things are. And I also know there's certain things that I'm not as good at, like finances and practice administration and things. So what I do is I surround myself with professionals and with staff that have the places that can fill in what my not my passions are per se, and I let people do those things, and I actually literally delegate those out and let them make the practice successful. And so I think it's leading a team. It's like being a coach per se. It's utilizing the talents of the people around you with the desired goal to do a good job for patients.
Mm-hmm. All right, that's great. So let me talk about another subject. So, the word trust in a dental practice is a really big word. Being able to have trust with patients, have trust with your staff, being the fact that you have been, a very successful dentist, how have you approached that in your practice?
I think trust is something that you have to earn, and in a sense, what trust means is that it's tell, show, and do. If I'm going to work with a patient, I have to first of all make a good diagnosis. I have to figure out what their need is, explain it well to them, and then be able to deliver the care in a manner that's efficient and planned out well. And I think what happens over time is if you consistently do those things, you treat your staff well, you get them involved, and you're just totally honest and open, I think people learn to trust that you're going to do what's in their best interest. And then they tell their friends, and then over time, people just know that you're genuine. You're going to deliver what they're after.
That's a good thing. So when you're with a patient, Dr. Fordice, how do you understand what's going on in their mouth? How do you get the patient to talk about what's going on in their mouth?
Well, obviously, just ask questions.
Mm-hmm.
And I think a lot of patients really don't know what you think or how to figure out how you get your teeth fixed up if they're not perfect. And really, again, that is the diagnosis, having really good abilities to x-ray, the proper x-rays, the proper exam, looking in there and having an understanding of what dentistry can and cannot do for a patient. Then my job is to take all that information and try to put it in an understandable terms. Because if I throw dental terms at people, their eyes will gloss over. But really what it comes down to is it's my job to kind of come up with 2 or 3 different ways of approaching things, not be afraid to say, I think this is probably the best one,
Mm-hmm.
but if you don't want to do that, we could do something else. Giving people options, giving people the understanding of what dentistry can do. I think those are the things that will help a patient to understand what they can do to maintain their health.
Okay. Tell us or talk a little bit about your team. You mentioned it earlier, but I think a lot of your success as a dentist has been because you've had a great team around you. Why don't you tell us a little bit about them?
Well, I really do have a really good team. I don't even know
Yes, you do.
the longest or the shortest is, I don't know, 10 years, and some patients or some of these staff have been with me for 25, 26 years. And they truly are part of a team. We work together on trying to accomplish our goals for each day. And I do actually delegate out to the staff what their job is, and they are part of determining how that job gets done. So in other words, I'm not dictating to them that this is how it's going to be. It's more of a, how do we accomplish this together?
Mm-hmm.
And I think that's why the staff is loyal, and the staff is really patient-centered. They really do want to make the patient experience good. So when we're all working together on that team, it just is a good atmosphere.
Mm-hmm. As a dentist, Dr. Fordice, what did you follow a blueprint for success, like when you started, or did you kind of learn along the way and you kind of learned some things and, here we are? Because so some dentists have a plan, some kind of do. Tell us a little bit about that.
Well, I started out in dentistry not knowing anything, obviously. Before you go to dental school, you don't know a thing.
No.
So obviously dental school was a big part of it. Going to the University of Iowa for a residency. I worked in Duluth for a couple of years with a really good dentist before coming to Fairmont. And then taking some classes. There's probably a dozen different instructors that I've taken classes from over the years that have been very influential. And the other thing is I have a dental consultant. and that's you people. And you people have helped me to implement systems for how we schedule, how we do all aspects of dentistry. And when you get systems and then you combine that with the artistry, the technology, and the education part of it, then everything seems to click along pretty well. And so what you bring to the table is that you're looking at dental practices all over the state and the region, and you can then give us a perspective of how do I actually deliver care the best way.
Well, thank you for those kind words. Very much appreciated. Thank you.
Yeah.
So as a dentist, Dr. Fordice, if you were to take a look at your career and say, okay, you know, the best lessons that I have learned were these two, what would those be?
These two, let's see. Again, I would probably say the number one thing is just treat people the way that you would want your family members treated. Okay. I would say that's absolutely number one. And then number two is what was alluded to earlier, is that I'm really not in the dental business per se. I fix teeth, but the central thing is that I'm really in the people business. How do I help somebody stay healthy and to have a comfortable mouth that can chew well and smile well? If you keep your eyes on that goal of just making it a great patient experience, the rest of it just falls in place.
There's a large number of dentists who don't put that together, Dr. Fordice. It's much more teeth-centered than it is people-focused, and the people who go there, they feel that. And to watch you kind of grow into that has been a very rewarding experience. So I just thought I'd share that with everybody. It's been really great.
Well, it is, you know, you're trained very technically in dental school, and they don't talk about human relationships very much. No. It is not the thing that you're taught. You have just enough time to barely get all the stuff they're trying to teach you in.
Yes.
So, yeah.
So let me ask another question. So getting a patient to move ahead with the life-changing dentistry that you know that they need, you know, explain a little bit about that process for everyone.
Well, I think that, you know, I think most patients think that I'm going to come along and try to talk them into doing it.
Yeah.
And it's really not that way. I think my job is to do, like I said, proper assessment, figure out what their needs are, and try to explain it in a way to what the benefits to that patient are. Okay, whether it's going to be comfort, saving time, saving money, whatever it is. And if I can get that across to them, I don't have to try to talk people into doing dentistry. My job is to present what the options are, what dentistry can do, and then try to provide a way for them to attain that. And if I can accomplish that, either whether it's financial arrangements or doing work in phases or not doing anything for the short term, whatever that need is, that and working out and talking with the patient so we come up with something that we're both agreed on. I don't have to get people to say yes. They just, I think they sense that they can trust that you're going to do what's best for them. And so that is again, that's a relationship. It is not a thing where it's a piece of paper with a plan for X, Y, Z. It is, but it isn't. I don't know if I'm explaining it very well, but it's really, again, let's summarize it. We have to have a relationship where we know that we're going to do something that's in a patient's best interest.
Yeah, I think you actually said that very well. That was very well put. It's much more a relationship focused piece than it is you telling me, the patient, that I have to do this, this, and this. Because I think you and I would agree, no one likes to be told anything.
Yeah,
um,
that's for sure. Yeah.
I mean, I was a little kid, and of course, my parents told me to clean up my room, and of course, I said, no way in the world am I going to do that, and I didn't.
Yeah.
I never did that. But yeah, but when you can have a relationship with the patient and have the trust, like you've been talking about, which you do, that makes it much easier. I think it's much more rewarding. At least I've watched you do it. It's been great. The Dental Breakdown Show, sponsored by White & Associates Practice Consulting. Better business, better dentistry. They are a practice management and consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits and result in the personal and professional success of the dentist and his or her team. Dr. Fordice, let's talk about something completely different. No, we're not talking about dentistry. Let's talk a little bit more about you. What are some things that about you or about yourself that your patients don't know, or maybe your staff don't know about you?
Well, recently my daughter has this book on whether you're an optimist or a pessimist, and I took this test in the back of the book, and it said that I am an extreme optimist, and I actually am. I lost my wife. I've had some other issues that have happened in life,
Mhm.
but I'm still an optimist. And I've been thoroughly blessed by God and by the people around me. And despite some of the stuff that happens in life, I'm still hopeful.
Mhm.
Uh, Another thing that doesn't seem related to dentistry, but it is all of my interests and hobbies are related to using my hands. I just love, I
Win.
just don't sit still. I just am
You
always
don't.
doing something that's, artwork or carpentry or remodeling or restoring a car or whatever. I just love hands-on things. So
Mhm.
that's a couple of things.
So let me go back to this being an optimist piece. I mean, you have had some major challenges in life that I think other people, might have had a much more difficult time being able to get through. How have you been able to meet those challenges head on and still been able to be, a productive dentist, a productive husband? Tell us about that.
Well, that's a complex thing. I think it's part of it's your makeup, part of it's your upbringing. Um, but I think the human being is not just it's not simple.
No.
We're a body, we're a mind, and we're a soul. And I think you have to take care of each of those areas. And in the soul part, um, my faith has
Mhm.
really been key to this optimism, I think, in the sense that I can't explain how you can have true sorrow in the loss of a wife, but total peace at the same time. It's something that I can't adequately explain to you, but I have experienced. So
Uh, let's talk about being on a stage for a second.
sure.
Um, the patients, everybody might not know what I'm talking about, but I know that you do. In dentistry, are we always on a stage? Are patients always kind of paying attention to what we're doing in the practice? Why don't you talk to us about that?
I really think that your patients are hyper focused on what you're doing.
Mm-hmm.
And so, in that sense, you are on a stage. Uh, However, a play lasts for what, a couple hours at most, or something like that. And dentistry requires high levels of concentration. You got a lot of skills you've got to do. You've got to keep your patient comfortable. You've got to make sure that they are um, that their psyche is okay, that they're that literally that they know that you're going to get them through this, and that's all day long. So it's longer than a play, and you got to be on. So it does require a lot of concentration and preparation. On the other hand, I think that as you do these things over and over, you get to a level of proficiency where I know what I can and I cannot do. And so I think patients can sense whether you're confident or not that you can pull off what you're saying that you can do, and they know, okay. And so in that sense, it is like you're on a stage. They're watching my level of comfort, and they're hoping to have good results. They want to be comfortable themselves, and all these things all have to come together just right to be able to do superior dentistry. And I find it a challenge. It sounds fairly simple, fixing teeth, but it's fairly complicated. But I thoroughly enjoy it.
Thank you for listening today. I'm Christian White, the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. If you would like more information on today's topic, you can contact us at whitedentalconsulting.com/breakdown. Keep those teeth white, and see you next time on the Dental Breakdown Show.